every so often you got to take a step back and you got to look at the bigger strategic moves and you got to think through things. You got to use critical thinking to have a big picture understanding of what's going on and kind of like say, okay, here's the map and which route do I want to take to achieve, to get to my goal. Hey there, welcome to the Dr. Marketing Tips Show. I am Jennifer.
And I'm Corey.
Today we're going to talk about something everybody loves and dreads, which is a little strategic planning and starting to really think about what the game plan is going to be here in the next 12 to 18 months down the road.
Yeah, it's one of those things where you oftentimes get so busy in just the day-to-day minutia, in the weeds of everything that's going on. All of a sudden you pop your head up and you go, uh-oh, well, the year's almost over, budgets are due, and now I need to figure out what we're going to do for next year. Is it just status quo? Is there a new competitor? Is there some new technology I need to know about? So all these factors kind of go into planning, and that's something that we're starting to do with a lot of our clients, and we thought it made a ton of sense to bring this to you guys and just kind of peel back a little bit of the curtain here and say, this is what we're focused on and the conversations that we're having to sort of lead to the strategic planning more so than the tactical items of what the plan kind of involves, which again, we will cover those things, but thought it made more sense to kind of discuss 30,000 foot view first.
Yeah, because, just like everyone watching or listening to the show, you probably deal with the same things that we deal with. And, there's always like there's this group of folks on the team who are doers, who are very tactical. And they're like, okay, what's the plan? What do I got to do? And that's often, where we're focused on. But the reality is, every so often you got to take a step back and you got to look at the bigger strategic moves and you got to think through things. You got to use critical thinking to have a big picture understanding of what's going on and kind of like say, okay, here's the map and which route do I want to take to achieve, to get to my goal. And that starts with the conversation. Doesn't start with, okay, do A or do B. It starts with, all right, if we have a perfect slate, what's the game plan going to be for this big road trip, called life? So that's what I want to talk about. So we've been doing it with our clients. So, a couple things that we first like to do when we get everybody together is we like to recap on what we've done this year or, the last 18 months or so that we've been really proud of. What are those big things that we delivered on that we're like, what, let's pat ourselves on the back because that looked good, that performed well, that got the doctor's attention. These are things that were a home run. And it's also a great way to set the stage to start with the positives of, things that are easy, which is really having a chance to highlight and showcase work that got done.
Well, yeah. And on top of that, I think, again, as you look back for these things, as you are creating the marketing plan for your practice and you're executing on those items, you wind up doing so much that you sometimes forget about what some of those major deliverables were or the campaigns that did really well. And it's useful as you're planning. Sure, it's nice to give the team some kudos and recognize that you were able to, move the needle a little bit. But it's also great because then you can say, oh yeah, that quiz that we put up on the website at the beginning of the year is still driving leads in November. Let's do another one next year. So by looking at these sort of major deliverables or, even if you've developed a plan and let's say part of your plan is you're going to deliver or you're going to produce a piece of content a month for your website or whatever, but then you have this out of scope project that pops up and you do a little bit of, I don't know, video that you weren't planning to do. So it wasn't on your roadmap, then it happened. Well, did it work? Did it perform? This is where we want to look at what we've done this year and then take that lens and then turn that towards the upcoming year and say, okay, let's now replicate what was successful.
That's it. Or hopefully you're having conversations with your peer groups. What are they doing that is successful? What, when you're talking about your big wins for the year, take a look at your competitors or the folks that you like to emulate, or other practices of a similar size, similar specialty. What are they doing that you're like, you know what, that's a great thing. Let me find out like how they did that, or maybe we can replicate that. Those are things that I think we should be thinking about, like when we're looking at best practices or what we did that performed. Something we often forget to celebrate are like when we get big projects through the finish line, because we're often on to that next project. But I think that there is no finish line when it comes to marketing, especially marketing in today's world. So if you launched a website this past year, next year, you've got things that you have to do to that website. So if, whatever you launched that was successful in 2025, what's that version 2 or version 1.2 for 2026? And so those are things that we need to be looking at from a big picture standpoint.
Yeah, and one that just zooming out a little bit more too, that I think sometimes gets lost, and I'm always shocked by the conversations that I have with either the marketing folks or even practice leadership sometimes when we're talking about strategy and we want to say, okay, so what are some of the KPIs, what are the key performance indicators? What are the things that we want to focus on? And, ultimately, what are the business goals? Like, what are we trying to do? How do we measure success? And so many times that answer is, well, we would just want to be busier. Well, that's really hard. That's hard to measure. And so I think that as you look for whatever the next plan is going to be, it makes sense to put numbers to these things and say, I want a 10% increase in website traffic, or I want 10%, more leads at the top of the funnel. Whatever makes sense to you, that allows you to measure and baseline and say, we are achieving this goal or we are not. Then you can pivot and make adjustments. But if you just say, well, I don't know, the clinics should be fuller, I guess. Well, that's not really a good answer. That's hard to actually nail down and move forward. Hey, before we jump back in, quick question. Have you actually taken the time to plan for next year yet? If not, we're offering a free 60-minute strategy session for medical practices just like you. We'll look at what worked this year, what didn't, and where the biggest opportunities for growth are. You'll walk away with a simple one-page snapshot that includes your wins, your blind spots, and maybe some things you might want to consider doing. It's totally free. There's no strings attached. And you can get it right now by visiting insightmg.com/strategy to book your session and get ahead of the curve. That's insightmg.com/strategy.
Well, and I think there's a noticeable difference, at least for me, when the clients that I work with, where I'm on the team versus I'm just a vendor. So I say that because a lot of the things that marketing is measuring are not things that marketing directly impacts per se. It's just, it gets measured on the dashboard. So like, as an example, I keep a marketing dashboard for one large orthopedic practice, and we measure like surgical ratios. So like, what percentage of patients that came in opted to get surgery, because we're looking at those surgery numbers. Well, marketing is not impacting whether or not Corey decides to get a knee replacement, but it is something we're measuring because it's a business goal for the client. So if you want marketing to have measurable goals and for us to build programs that are going to help achieve the business goals, it's really helpful to have marketing be part of that conversation. Because for me, if I'm like, the web person or the marketing person at a practice, yeah, sure, I'm going to say I want more website traffic. I want better leads for, to come in. I want more qualified. I want to fill my walk-in clinics, my urgent cares. But I don't know, like on the ops side, if they've got capacity, if I bring those patients in. And I don't know where the communication breakdowns are going. So instead of working in silos, how does marketing impact ops, and how does ops impact marketing, things of that nature? I think it's super important for determining KPIs. Yeah,
I was working pretty recently with a behavioral health group, and we were talking about that exact thing. And we were saying how so we wanted to increase budget, and the way that we were going to do this was we were going to look at capacity reports at particular clinic locations and then determine where there was space. And luckily, because they are not siloed, we were able to, before we actually implemented that, the marketing leader there was able to say, hold on, wait a minute. If we coordinate with ops, let's look at the wait times for the phone system at some of these offices. And what we found was that if we implemented some of these budgets, the office was not going to be able to actually handle any increase in calls, and we were just going to wind up with upset patients. And so we were able to mitigate that before it even started. So to your point, yeah, when you can sort of break down those barriers and bring more people to the table to have the discussion, you'll be really surprised at what kind of unlocks from there, because of that, in that example, we were able to divert the dollars elsewhere and still move the needle, but we didn't create any unnecessary headache or problems because we were able to quickly identify that and have that conversation.
Yeah, and when you're putting together a plan, it's the action items, and it's hard to have definitive action items from this type of conversation, which is why you have to start with these strategic conversations first. You got to like have these conversations on a regular basis. You know, you need to, one thing that I like to do is take a look at where we might have blind spots. So I have a practice that I work with, and they had some changes in work comp where their referrals for work comp were going down. And we started evaluating the relationship with the vendor who helps with work comp marketing. And they have us and they have a work comp marketing group. And we identified pretty quickly the blind spot is that the agency controls all of the marketing contacts. So you partner with this group because they have contacts in the industry, but they hold it very tight to
they own those contacts.
So our client is not able to move out on their own because they're locked in. We identified that as a blind spot. And now that's something that we're going to start putting into play for next year, is building our own relationships and our own lists, so we're not beholden to one partner over another. So these are the types of things to be considering.
Yeah, I think when you're looking at, what's important to focus on, it's not just the new patient acquisition goal. It's exactly what you're saying. There's some work comp that goes along with that. In some cases, there's reputation, there's staffing concerns. HR and recruiting is not necessarily a part of marketing, but it should be. And I know that in a lot of the accounts that I deal with on the regular, we always talk about staffing and how to improve culture and how to, like, what are the recruiting goals? How do we beat those? If we beat them, well, how the hell did we do that? And how do we do it again? And so that, again, that just, by having those additional groups at the table, it also lets you budget plan, because if you don't think about staffing as you're just trying to cobble something together, you may find out in March that all of a sudden, you've got a huge blind spot, like you were just saying, from the staffing standpoint, and you don't have the budget to do anything about it. So then everything suffers because you have to divert budget away from some of your other initiatives.
And I think it kind of boils down to, like, when we're doing our strategic planning, like really honing in on some of those pain points. Like the example I gave is that we don't own the data. We don't own the relationships. That's a real pain point. Or we don't have adequate staffing. That's a pain point. Or we build an entire ancillary service around one or two physicians and then they retire. That's a nightmare, but those are pain points of things that we have to work through when we're going into our planning for next year.
Yeah. Or I was on the call with the orthopedic group yesterday. They are losing a spine surgeon who recently joined the practice and was becoming a high volume producer for them because like more or less his wife wanted to move, didn't like the area. So he's gone. And yeah, there really wasn't a plan in place for that because it happened so sudden. And he was there just for 6 months or something. So yeah, it's best to review what some of these key initiatives and campaigns are. That will lead to budget recommendations. And one thing that we've been talking about a lot is kind of looking at, like, almost developing a report card or a snapshot where you can actually have this satisfaction level. with some of the things that are going on. And I love this idea because it's visual and it allows you to see something at a glance, but also if you are reporting to any executives or, marketing committee or, just pain in the butt type of doctor, if you need something, you can say, hey, we keep this report green, yellow, red, here's what's going on. And then you can comment on those things and make adjustments, which I really like.
Yeah, I really like that. I'd like to see that too.
Mm-hmm.
I think that's a great one. Another thing I think is really a good exercise to go through with the team, or whether it's your planning or just on the regular, but like how do you deal with the unknowns? Like what would you do? Like throwing out scenarios. Like what would you do if tomorrow your number one doctor retired or left the practice unexpectedly? How would you deal with that? How would you divert eyeballs and patient communications, if that scenario happened? Or what would you do if you went to bed one night and everything was good, and then you woke up the next morning and you had a random TikTok video against your practice that had 100,000 shares? That's a true story. If you haven't listened to that episode, make sure you go listen to that case study. But what would you do if that kind of negative, backlash hit you hard one morning? How would you mitigate that with, the general public?
Yeah, it's an unfortunate thing to have to do, but having some type of scenario planning in place can really help when there is some type of crisis or shift. It can be as sudden as the TikTok video, or like I just mentioned a minute ago, a new surgeon that's, just starting to pick up steam, suddenly leave, pull the plug. And
what if the hospital decided they were going to no longer, play the game with you being on call, and instead they were going to hire your entire specialty in-house? How would you mitigate that from a practice level? Another true story.
Or merge with your biggest competitor and bring them into the hospital. Another
and
true
then
story.
build them their own hospital and call it a specialty hospital. And put millions of dollars behind it with their nonprofit status and run ads constantly. How are you going to deal with that as a practice? How are you going to deal with it if the road closes in front of your office, or a hurricane comes, or a tornado or an ice storm? What are you going to do to keep patients coming in?
Yeah, I think that's all part of having this, just having an eye on competitor shifts and also some, risk mitigation and emergency planning. I think another thing that makes sense is to also look at any sort of, well, there's two things you should look at from a trend standpoint. I think as you're kind of planning, one is sort of local market trends that could impact what's going on. Maybe there is, like, for example, I was talking to a group yesterday, and they're thinking about opening a new office in this new like master plan community. It's massive. So that is going to be a huge marketing opportunity, but a shift as they look at this new location. So it's just useful to kind of know those things. And then outside of that, if you zoom out of the local piece, just sort of what's going on globally. And I mean that from a technology standpoint, because we talk about this all the time, but there are so many shifts that are occurring right now from the way that people are getting information. It's really fragmenting the, just go Google it or go search for it. That is still the case. I mean, Google still kind of reigns supreme, but people are starting to get a lot of their information from other sources. And if you are unaware of those things, or you don't fully understand them, have not embraced them, then your competitors are going to pass you by.
Yeah. And these are all things that we have to be talking about so that we can dive into it. And we do this for our clients. Another thing we do is we look at the full year's worth of data that we have available. So we look at traffic patterns on the website. We look at our heat maps of where patients are clicking, because I think that informs conversation. Where's traffic coming from? We're finding now 70+% are coming on a mobile phone, but 70+% of websites out there are not optimized for mobile, especially in healthcare. We're looking at, reputational trends. What's being said on Google, what's being said on Healthgrades, because those are really the biggest ones that we should be paying attention to. We're looking at social media really data, what performed from a content perspective. And we're trying to come up with like a baseline for everything, right? We're looking at the numbers. We put it all into kind of a chart. We say, okay, here's, a breakdown per kind of category of things that are impacting our performance. And then we say, okay, did we go up or did we go down in each of these categories? And if we want to, if we know what the business goals are, and we know it's going to take us 10% more to increase those numbers next year, then we start looking at what those numbers look like. Then we start coming up with a plan. But we start by having these conversations, and our conversations, so we have probably 30 kind of questions that we go through where we're talking about a client or we're talking about, the practice in particular. Then we start analyzing the data and we say, what can we do better here? What pages have dropped off? What traffic sources have shifted, or, what are those outside factors that are starting to impact us? We put all of that together and then we come up with the game plan for next year. And so it really starts with, one, having a conversation, two, like really looking at the data and what it's telling you, because it will tell you a story. You just kind of have to know, like, to start picking up the book and really like looking at it.
Yeah, I think if you're looking at the data, one of the things to pay attention to is if you have any sort of like task management system, or even if you just have a giant pile of sticky notes, however you get things done, it makes sense to say, well, where were some of the struggles and what were they? Because again, as you're putting together this plan, if you know that you're going to put together a piece of content, now typically that has to go to physician review before it gets posted, let's say if it's a blog post or something, and that takes 6 weeks and 10 follow-ups with this particular surgeon.
It does. Another example.
Right. So if you know that that's the case, but you have to get something out for February, then you know what I'm going to say next. Then plan for that and avoid those missed approvals or delays or whatever the case may be. Because even if you think you're ahead, you're not.
No, you're never ahead. Plan for what you can plan for, because you're going to get hit with what you can't plan for. I can tell you that. All right, yeah. I think that's a good place to wrap it up. There's a lot that goes into planning, and sometimes what we need more than anything is just space in our brains and room to think and have conversations. And that's easier said than done. But right now we're recording this on October 1. And if you haven't started thinking about next year and starting to have those conversations, go ahead and get that stuff on the books so that you can be prepared for next year.
Yeah, absolutely. Like you said, there's definitely value in zooming out and taking a moment to say what worked, what didn't, and how can I be better tomorrow than I was yesterday.
Yep. And with that, I'm Jennifer.
I'm Corey.
We'll see you next time on the Dr. Marketing Tips Show. Thanks.
Bye, guys.
If you want more like this, hit like and subscribe so you'll always be alerted to new episodes when they come out. And if you want information about us, visit us over at insightmg.com. That's insightmg.com. We'll see you on the next episode.